Welcome back. Well, as you know, this month is Medicare enrollment period time, and also many people are choosing different type of health cares. So I have Dr. Bakan Shea, hopefully that was correct, and Christina Simons here with me. Welcome. Thank you for being here with Alignment Health Plan.
Yeah, thank you for having us.
You're welcome.
Thank you so much.
So you're here to talk to us about, obviously, the Medicare process and how they can go ahead and sign up for that. But let's first talk about what Alignment Health Plan is.
Absolutely. So Alignment Health Plan, Alignment Healthcare has been around for about 5 years. And Alignment Health Plan, we offer Medicare Advantage HMO and Medicare Advantage HMO Special Needs Plan.
Okay.
We currently service for 2019 8 counties, including right here in Orange County, which is also where our corporate offices are based. And what's exciting is that as a health plan, we partner with different types of doctors and hospitals, and many of our large networks are actually right here in Laguna Woods, which actually helped us get an expansion for 2019 to cover the full Orange County marketplace. So most likely, the Medicare eligibles who are looking at products, their doctor's already on our plan right now.
Oh, that's great. Okay,
yes.
Good. Tell me, how does it work with your particular type of plan? If they already are with someone else, what do they look forward to that you can offer?
Well, in addition to our rich benefit offerings, we actually provide a very unique model of care. So one of the things that we built out is something called our Command Center, which offers very high-end technology, where within the first 90 days, we'll actually have a patient visited head to toe, and we're actually helping the doctor with the complicated codes, and or the doctor may be able to capture that information.
Okay.
And what's exciting is that, and Dr. B, who actually is the lead architect, can talk about this, but we're actually able to get real lifetime data for our patients so that we can be able to be more predictive and focus on preventative alternatives so something doesn't become worse down the line.
Okay, yeah, let's go into what she's talking about.
Sure. So when we started the health plan about 5 years ago, one of the things that we really wanted to do was, I talk about my two 97-year-old grandmothers all the time, and one of which is living with me because they were evacuated from the Woodley fire.
Oh, wow.
And one of the things we wanted to do was, how do I find out what's likely gonna happen with her? What does she need? And then looking at my mother, who's the caregiver for her, and what does my mother need to be empowered in the care of my grandmother? And so as we built our model of care, it was really around the chronic needs of the senior, but also taking into account things like case management, and being able to converse and have medical information in front of you when you're making a decision. So what I've done for our clinical teams is create an architecture that we call the Command Center that has all the medical data in one place, out of medical records from the hospitals, from your primary care provider, the things the health plan has, Medicare has, put it all in one place so that if you were to call me and I happen to be the doctor on call and I've never seen you before, I have a very broad picture of your history, your needs, and can make a very educated medical decision on what we need to do next.
Okay.
And to provide that for the public is something that my grandmother gets because I'm a doctor and she's my grandmother, but not everybody has a doctor in the family. And one of the things that we wanted to do to be very different from other health plans was to give you almost like a doctor in the family, to where if you called us, we're not taking away from your primary care doctor. If you sign up with us, you're going to keep the doctor that you have right now.
Okay.
I know people have heard that before, but this is a different and this is a different story. And what I want you to do is continue with your primary care, with your specialists, with the hospitals that are in the area, but have an excess of information that we can help in your care.
Well, I like the fact that you have it all in one location, and you're really taking away kind of a fear or even a responsibility to the patient, or that the patient has to have that responsibility to find all of that stuff for you. You guys go ahead and you do that for them, right?
Right. And if you think about what that means from just a simple patient's perspective is, my mother calls and they're not in our service area, and she says, well, your grandmother's going to get another blood test. I said, why? I said, well, because this doctor didn't give the blood test to the other doctor, so he wants to repeat it again. I said, well, I don't want her to do that, and so I get on the phone and try and coordinate and get that information. We don't have to worry about things like that with us because we're able to pull that information and make it readily accessible for the doctor to be able to see, so we're not repeating things, putting people through painful needle sticks or more CT scans, things like that you don't really need and are harmful to you in the long term.
Exactly.
And try and keep that from happening.
Well, and you're also saving money all the way around, right?
Absolutely.
So
Right.
that's a good thing
But
too.
if that's the beauty of it, is you actually take care of people and preventatively anticipate what might happen and try and put your arms around somebody and care for them like you would your family. You actually save money, and we sustain healthcare. I've said it before, is that in this beautiful country that we live in, we call healthcare. We have no business doing that. It's sick care. We only really pay attention to the sick, and we're not paying attention to health. And what Alignment does is really look at, let's start focusing on the health in healthcare as opposed to the sick.
Okay, I like it. All right, well, let's talk about the actual enrollment period that's been going on since October 15th. What are some things that people need to think about?
Absolutely, thank you so much. So right now until December 7th, it is the annual election period. So right now, I'm sure a lot of the folks right here are getting bombarded with different types of direct mailers and invitations to come and learn about different health plans that they can partner with, again, with their large network of doctors and hospitals that they may or may not already be seeing. Come listen, come hear about what Alignment Health Plan has to offer. If you go to Medicare.gov, which is a CMS-approved website, you'll actually see that Alignment Health Plan has very high ratings, and it's not because we start with the letter A. We put a lot of work and
Although
effort
that is
into
a plus.
Absolutely. Now, a couple of the things that I want to also let the Medicare eligibles know is that next year, for January, February, and March, there's also the open enrollment period. So if they miss the opportunity to select a health plan that is best for them, they will actually have one more election, January, February, or March, to make a one-time switch to a like plan.
Okay, great. Perfect.
So, and then also with Alignment, we've also got some special needs plans. So depending on if they have low income status or if they have a special needs like either a diabetes or a heart condition, those folks may be able to enroll throughout the year as well.
All right, well, real quickly, let's talk
yes,
about the
let's
card
talk
you
about
have.
the card. All right, so this is a new program that Alignment is rolling out. What it's actually going to be able to do is allow our members to have 24/7 live access to a representative. So if they need help with guidance, understanding their how to navigate through their benefits like transportation, hearing, vision, post-discharge meals if they need some meals. These are all the things that it offers. We're also rolling out 24/7 telehealth.
Okay.
So they'll be able to see a doctor or have access to a doctor 24/7. And when I say 24/7, I mean 24 hours, 7 days a week, 365 days of the year. So we're going live with that.
Okay.
It's also used as a credit card, so they'll be able to use it to get select items at different types of stores
Pharmacies.
like pharmacies,
Okay.
etc.
Well,
so give us a
perfect.
call, find out. Well, lots of research to do.
Thank you so much for the information. We appreciate you both being on.
Thank you.
Absolutely.
Thanks for
Thank you
having
so
us.
much. Appreciate it.
And if you'd like more information about what we've just talked about in this segment, you can go to alignmenthealthplan.com. We'll be right back after this.